Case notes. Miss Amy Vineyard is a patient in your care at the St. Kilda Women's Refuge Center. She is 6 weeks pregnant with her first child. She presented 2 days ago, requesting help for her substance abuse problems. She reports a desire to reduce or cease her alcohol consumption and a desire to reduce or cease her drug use. No desire has been indicated to decrease or stop cigarette use. She now wishes to be discharged but will require ongoing support throughout her pregnancy. Discharge summary. Name, Miss Amy Vineyard. Age, 21. Admission, January 6, 09. Diagnosis, pregnant substance abuse. Discharge, January 8, 09. Plan. Community mental health nursing required daily for the next 2 weeks minimum. Patient wishes to continue living with a friend on her sofa. Psychiatric support needed for depression. Methadone program. Alcoholics Anonymous meetings. 1 trimester ultrasound at 2 weeks. Maternal health clinic appointment needed. Reason for admission. Patient self-admitted due to concern about pregnancy. Confirmed pregnancy test the days before, January 5, 09. Reported pain in the lower back. Weight loss, 6 kilograms over 2 months. Some memory loss. Tingling in feet, difficulty sleeping, excessive worry, and hallucinations. Feeling depressed. History of depression. No pain in hips or joints. No decrease in appetite. No double vision. Treatment. Patient monitored and blood tests for HIV or AIDS and STDs. Counseled re-nutrition and pregnancy. Counseled re-HIV or AIDS and STDs risk. Discussed the possibility of a rehabilitation clinic for driving out. Lifestyle. Nicotine daily 30 to 40 cigarettes. Started smoking at 15 years old. Drugs used: cannabis, amphetamines, cocaine, heroin. Started all above at 16 years old. Injects heroin, occasionally shares infecting equipment. Alcohol 8 units per day to maximum 15 units per day. Started drinking at 16 years old. Lives with a friend, Sophie, on her sofa. No contact with parents. History. Suicidal thoughts, self-harm in the past. Never seen a psychiatrist. Writing task. Using the notes, write a letter about Miss Vineyard's situation and history to the new community health nurse. Address your letter to Miss Lucy San, registered nurse, Community Health Center, St. Kilda. The date of drafting the letter is the discharge date. January 8, 2009. To address of the letter is clearly mentioned in the writing task. Address your letter to Miss Lucy San, registered nurse, Community Health Center, St. Kilda. Hence, the salutation should be: Dear Miss San. RE of the letter is RE, Ms. Amy Vineyard, 21 years old. In the introduction paragraph, mention why you are writing this letter. Your writing task is to write a letter about Miss Vineyard's situation and history to the new community health nurse. From the case note, you know, Miss Amy Vineyard is 6 weeks pregnant, with a desire to reduce or cease her alcohol consumption, and her drug use. Who require ongoing support throughout her pregnancy. No desire has been indicated to decrease or stop cigarette use, so it's not specifying here. Hence the introduction paragraph will be like this. I am writing to request ongoing support and care for Ms. Vineyard, a 6-week pregnant lady, who has a desire to stop substance abuse and alcohol consumption. So, now you should mention how the patient comes to your facility. And the case note says, patient was self-admitted due to concern about pregnancy, and the pregnancy was confirmed the day before admission. Here in this paragraph, you have to mention her concerns as well. Let's see how the paragraph can be structured. Miss Vineyard self-presented is our facility on January 6, 2009 with the concerns regarding her pregnancy which was confirmed a day before, as she is a drug abuser and alcoholic since the age of 16. She also complained of lower back pain, memory loss, tingling in feet, difficulty in sleep, weight loss, and excessive worry along with hallucinations and depression. Since we have already mentioned her alcohol and drug consumption in the introduction paragraph, here we add their history, along with other concerns. Here too, we haven't added anything about smoking. The reason is that the patient has not indicated a desire to decrease or stop cigarette use. Hence, we treat it as not her concern. Moving to the third paragraph, you should explain the treatments provided to the patient. Case note says, patient's treatment includes monitoring and blood tests for HIV or AIDS and STDs, counseled for nutrition and pregnancy, HIV or AIDS and STDs risk, and discussed the possibility of a rehabilitation clinic. Therefore, the third paragraph will be like this. During hospitalization, she was tested for HIV and STDs, and gives counseling regarding the same, as she occasionally shares infected equipment for heroin injection. She was also discussed regarding the nutritional need in pregnancy, as well as the possibility of rehabilitation driving out. Here, why the treatment for HIV or AIDS and STDs has been provided is also mentioned. That is, in the case note, under lifestyle, it is mentioned that she injects heroin, occasionally shares infecting equipment. Now, it's time to sum up. In the fourth paragraph, mention the lifestyle and history of the patient. So, your fourth paragraph will be: Miss Vineyard lives with her friend, and has no contact with her parents. She has been smoking from the age of 15, and uses 30 to 40 cigarettes. However, no interest to cease smoking. She has a history of self-harm due to depression, along with suicidal ideations, despite never consulted a psychiatrist. In the fifth paragraph, you can mention the care plan. Write the plan according to the case note. The fifth paragraph can be structured as follows. In view of the above, kindly provide a community mental health nurse support to Ms. Vineyard on a daily basis for a minimum of 2 weeks. Also, encourage her to participate in methadone program Alcohol Anonymous meetings. Please arrange a psychiatric appointment for depression and a maternal health clinic appointment for first trimester ultrasound in 2 weeks. Conclude by saying, all the relevant documents are enclosed. Please feel free for further queries. Sign off the letter. Yours sincerely, Registered Nurse.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.